right, good afternoon. Thank you everyone for joining us today for this webinar. My name's Laura Katawaki and I work for United Way, British Columbia, and so I'll be hosting the webinar today. So thank you for joining us. Today we're really excited to be able to have a presentation entitled Working Together to Build Dementia-Friendly Communities. And this features presentations by the Alzheimer's Society of BC and also Simon Fraser University's DemSCAPE project team. And so today we're going to have an opportunity to learn more about dementia-friendly communities, which are places where people living with dementia and their families and caregivers can feel included and supported. So we're going to learn more about how we can make our communities dementia-friendly. And before we start the webinar, I'd like to do a land acknowledgement. So I'd like to acknowledge the homelands of the Indigenous peoples of this place we now call Canada and honor the many territorial keepers of the lands on which we work. I personally today am working from the ancestral, unceded, and traditional territories of the Coquitlam First Nation. And so I thank them for continuing to live on the lands and caring for them, along with the waters and all that is above and below. And I'd also like to acknowledge that today is, or this month, is National Indigenous History Month. And we also have coming up on June 21st, National Indigenous Peoples Day, which was first announced in 1996 and has been celebrated on June 21st since. So this is a wonderful time for us to learn more about the Indigenous territories and peoples in Canada, and also to reflect on the history of Indigenous peoples in Canada. And so I'd like to share one resource that I've come across recently when I've been trying to do some of my own learnings and reflections. And so this is a website called First Voices. And so I'll share the link in the chat. But this is a really interesting online space and platform, which is designed to help Indigenous communities to be able to promote their languages and to share the languages and the oral traditions that have unfortunately been lost in many communities. So I will share the link in the chat, and I would encourage you to look at this as it's a very interesting site where you can look up different words in a dictionary, you can look up different languages, and you can learn more about those languages of the First Peoples in Canada and other communities as well. And before we get started, just a few housekeeping items. So during the webinar, everyone is going to be muted. Do feel free to introduce yourself in the chat, though. You can put in your name, the organization, your pronouns, the territories you're calling from, whatever you feel comfortable sharing in the chat. If you do need closed captioning, you can turn this on using the closed captioning feature in the toolbar. And during the presentation, there will be a brief question period at the end, but you can also put questions into the Q&A feature at any time if you like. And also, just so you know, this webinar is being recorded and we're going to be posting it on the Healthy Aging Core website after the presentations. All right, so then without further ado, I'll introduce our presenters today. So our first presenter is Sana Aziz, and she's a gerontologist, changemaker, and advocate for older adults to age well with dignity and support in accessible and inclusive communities. And in her current position with the Alzheimer's Society of BC, she leads the Society's Dementia-Friendly Communities Initiative and works closely with municipalities, community organizations, businesses, and service providers to work towards becoming more inclusive of people living with dementia and their care partners. And Sana also has a Master of Arts degree in gerontology from Simon Fraser University. And our second presenter is Dr. Habib Chaudhry. He's the chair and professor in the Department of Gerontology, and he's based at Simon Fraser University. He has research experience in the field of environmental gerontology and has conducted research in the areas of the physical environment and its role for people with dementia in long-term care facilities, on memories of home and personhood in dementia, community planning and urban design for active aging, and dementia-friendly communities. He also conducts evidence-based consulting with national and international organizations in the areas of planning and design of seniors housing and long-term care facilities. And he's affiliated with the Center for Research on Personhood in Dementia at the University of British Columbia. He also serves as the editor-in-chief for the Journal of Aging and Environment and is a member on the Ministerial Advisory Board on Dementia with the Government of Canada and on the Canadian Institutes of Health Research Institute of Aging Advisory Board. So today we have these two wonderful presenters and are very much looking forward to their presentations. So I will hand it over now to Sana so she can begin her presentation.
Thank you, Laura. I'm just going to take a second to get organized and share my screen. So just bear with me, everyone. Okay, I'm wondering, Laura, if you're able to see my screen. Thank you. I just want to make sure I'm seeing everyone else. Okay, perfect. Okay, this looks good. Thank you very much, United Way, and Laura, thank you for the invite to come and talk about a topic that's really close to my heart. Really great to be here and presenting alongside Dr. Chaudhary that I know very well, and really happy for us to be talking about this important issue with all of you. Today, we're going to shed some light on what we call dementia-friendly communities. We'll talk a little bit about what those are, what does it entail, the characteristics that define a dementia-friendly community, how you in your role can be more inclusive and supportive of people living with dementia in the community. And right after my part, I'm going to pass it over to Dr. Chaudhary, who's going to walk us through some of the environmental factors that create inclusive communities. Before I get started, I want to do a really quick overview of what dementia is so that we're all on the same page when we're talking about what it means to be inclusive of people living with dementia. So one of the most common questions we hear at the Alzheimer's Society is, what's the difference between Alzheimer's disease and dementia? Dementia is an umbrella term that describes a set of symptoms affecting brain function. It's a chronic condition that gets more severe over time and is often characterized by a decline in memory, planning, language, judgment, change in behavior, and moods. Often it's associated and it's combined with some physical changes like loss of coordination, perhaps loss of bladder control, becoming weak and having stiff muscles, sometimes trouble standing, sitting, and as well as visual changes. There are 5 main sort of groups of dementia, and each of them are distinguished from one another by how the underlying disease impacts the brain. So, for example, Alzheimer's disease is probably the most common type of dementia that we see, and there are different subtypes of Alzheimer's disease, but typically it's caused by plaques and tangles in the brain, and those deposits can damage the brain. Another common type of dementia that we hear about is vascular dementia. And although it's not as common as Alzheimer's disease, it's typically caused by damage to the blood vessels of the brain. Frontotemporal dementia is a group of dementias that are characterized by the disease that is active primarily in the frontal and temporal lobes. So somebody who has frontotemporal dementia, the part of the brain that's responsible for communication may be impacted first. We also have a large number of rare dementias that do not really fit into these groups, and we see them less frequently. Sometimes people have what we call mixed dementia, where there are 2 types of dementias that are making changes in the brain. So, for example, somebody may have Alzheimer's disease and vascular dementia, so they present symptoms of those types. How the disease progresses may look different from one type of dementia to another. So, for example, vascular dementia may progress in a more stepwise manner, whereas other types of dementia may progress in a more gradual decline. It's important to note that there are two things that all dementias have in common. All dementias are progressive or degenerative in nature. This means that the disease will advance and symptoms will worsen over time, and it is eventually fatal. The changes that people experience are permanent and not reversible. It's also important to note that dementia affects each person differently and individually. So we often say here at the society, when you know one person with dementia, you only know one person with dementia because this disease affects each individual differently. I always like to share this particular image when I'm talking about dementia. It's not a very pleasant image to look at or discuss, but it's important that we understand and recognize that a disease is causing changes to happen in a person's brain. And those physical changes are causing their symptoms. So, oftentimes, a person with dementia doesn't look any different on the outside, which makes it difficult for care partners, family members, friends, people in the community, service providers, for instance, people like yourselves. It gets harder to really see what a person with dementia may look like. In fact, we hear from people living with dementia that this is one of the most difficult reactions that they receive, often being told, "What do you mean you have dementia? You look fine." While there are several different diseases that cause dementia, they share many symptoms. Eventually, the damage to the brain cells caused by the disease leads to pronounced shrinking of the brain or atrophy. Now, when you look at the brain on the right, you can see there are profound changes. There are big gaps and holes. The changes are permanent, and no amount of prompting, encouraging, repetition, or insisting we can do can help a person who has dementia to remember something that they have forgotten or to recognize that they're experiencing changes if they don't see it, or to relearn a skill that they have lost as a result of this disease. Their brain may no longer have the capacity to adapt and change. So, in order to stay connected and be included in the community, it is up to us, people in the community, people like yourselves, people like us, as a larger community, to change and adapt so everybody living with any kind of abilities is able to participate in their community for as long as possible. So, what can you do as part of the roles that you all carry? And thank you for sharing some of your introductions in the chat. It was really nice to see that we have a wide range of people joining us today. So, I want to take a second and prompt you to think about what your role is as we talk about creating inclusive communities. How can you and what can you do to ensure that people around you who may be living with dementia, how can you support them? How can you recognize that they have dementia? How can you communicate more effectively and appropriately so that they can understand what you're saying as well as feel supported and inclusive? Take a second to think about what it means to be dementia friendly. What is a dementia friendly community? Now, you may be familiar with the concept of age friendly communities. Age friendly initiatives focus on creating communities that are supportive and inclusive for older adults by reducing ageism in the social environment and by improving accessibility and support mobility in the physical environment. Dementia friendly initiatives build on this concept by including considerations for people living with dementia that aren't included in age friendly design. So, for example, in age friendly communities, it is important to have seating areas such as benches with armrests and back support readily available throughout the community so people can sit and rest if needed. In a dementia friendly community, it's also important to consider a person's cognitive and perceptual changes and ensure that the bench actually looks like a bench. While a bench that looks like a piece of modern art is aesthetically pleasing, a person living with dementia may not recognize it as a place to sit. So, in a nutshell, dementia friendly community is a community that focuses on stigma reduction and the inclusion of people living with dementia. It is a place where people living with dementia feel supported by individuals, businesses, and local governments, and are able to participate in their communities to the fullest extent possible. And most importantly, dementia friendly communities are defined by both their social characteristics, which I'm talking about today. So, for example, community members being able to recognize dementia, are educated about dementia, understand the signs of dementia, and are confident and willing to reach out and support people living with dementia in their community. Dementia friendly communities are also defined by their physical characteristics. So, clear and legible signage, well kept streets, easy to use street furniture, for example. And I know Dr. Chaudhary is going to talk a little bit more about that in his talk right after this. So, as we think and talk about what it means to be a dementia friendly community, it's important to recognize the social and the physical elements that really make a community that's inclusive. I'm going to shift our gear and for take our direction to watch a little clip. Now, this video is really by people who are living with dementia, a short video that came out of the Dementia Friendly Canada project, which really illustrates what being dementia friendly means in our community and what that can look like. Just bear with me for a second as I bring us to the video. Okay.
Did you know that more than 500,000 Canadians, like me, live with dementia? Or that 1 in 5 Canadians care for someone who lives with dementia? Like me, many people living with dementia still live in our communities after we are diagnosed. It isn't always easy, though. Often, we feel left out and worried about how we'll be treated by others. Sometimes people just don't understand what dementia is and how it affects the brain, or know what to do if we forget something or get confused. So they seem frustrated or dismissive, and sometimes the places we'd like to go are just more difficult to get around. I once got lost trying to find the washrooms in a restaurant because of the loud music, poor lighting, and confusing signs. But it doesn't have to be like this. Everyone in the community can play a part in helping people living with dementia feel welcome and in creating accessible and inclusive spaces for everybody to enjoy. When our communities are dementia-friendly, people living with dementia feel less worried about how we will be treated and more confident about going out. Have you ever thought about what it would be like to live with dementia in your community or workplace? Is your community supportive, inclusive, and accessible for people living with dementia? Is it dementia-friendly in ways that let people stay engaged in community life? Would you recognize the signs that someone may be living with dementia and be able to offer the right type of support? Would you be comfortable talking to someone if you knew they were living with dementia? Would you know how to respond if someone seemed confused or had trouble expressing themselves? Are the businesses, organizations, and public spaces in your community designed so people can use them independently without getting disoriented, lost, or experiencing stigma because they are living with dementia? People living with dementia shouldn't have to work harder than everyone else to stay a part of the community. Wouldn't it be great if the neighborhoods and communities that we all share were dementia-friendly? Together with the Alzheimer's Society and community members like you, let's keep challenging the stereotypes and building a dementia-friendly Canada where everyone feels welcomed and supported. Take the first step and visit alzheimer.ca/dementia-friendly Canada to learn more about Dementia-Friendly Canada. You'll find lots of information, education, and resources to help you and your organization become more dementia-friendly members of your community.
So, as the video really talked about some of the things that are create and make up our social characteristics of being dementia friendly, we've heard firsthand from people who are living with dementia telling us that the biggest challenge they face when they're in the community is the stigma that's associated and the societal barriers that come in the form of discrimination and assumptions. People often tell us that they will hear things like professionals don't know how to talk to them directly. They will experience stigma from professionals, assumptions about their abilities. As soon as people hear that they have a dementia diagnosis, their friends and family backing away. People living with dementia have told us that often they feel very isolated and just stigma by association. So care partners feel like people are withdrawing from them, or close friends are removing them from their social circles. And over time, stigma, discrimination, and embarrassment and shame have a profound impact on a person's confidence and willingness to stay engaged in their community. Hence, these conversations really allow us to talk about this more openly, engage in conversations, and work towards making our society a bit more understanding and inclusive so that we are better equipped to support people and welcome people who may be living with dementia. How we talk about this really is important as well. The language we use really matters. So, being very conscious of what you do, how you address people who are living with dementia. A person is more than their diagnosis. So, it's important to avoid assumptions about the person's abilities or experiences just because you think or know that they have a dementia diagnosis. Calling somebody that they're suffering from dementia or afflicted with dementia or their dementia patient really takes away from the personhood of their personhood and who they really are. Using words like demented or senile are also not acceptable to say, as they actually take away from the person that we're referring to. People that support a person living with dementia often tell us how difficult it is to be in the community when the assumptions are carried before them. So using language that is person-centered really puts the person before their diagnosis, and it's an important step in raising awareness and creating inclusion. In the interest of time, I'm going to go over some communication strategies that may or may not be relevant to your specific situation, but something to keep in your back pocket as you may interact with somebody living with dementia for various reasons in the community. If you're interested to learn more, you're welcome to connect with us, and we'll be happy to walk you through these in more detail. We have a lot of information on our website as well. But before I leave it and hand over to Dr. Chaudhary, I wanted to share some examples here of what it means to have dementia friendly communication or person centered communication in your work. Now, some of these strategies may feel very basic or very simple, but nonetheless, they're good reminders of how you can ensure that the person you're communicating with receives information in the best way possible. So, set the stage when you're talking to somebody. Make sure that the lighting is adequate, that they can see you well, they can hear you well. Approach people from the front to get their attention. Remember that sometimes there's visual changes as people experience dementia and as the dementia progresses. So make sure that you're in their line of vision. Make eye contact, get their attention so people know that you're communicating with them. You may need to sit or you may need to get on your knees to be at eye level so they can see you better. Offer a quiet place. Sometimes, oops, I'm sorry. Sometimes it's so loud and noisy in social settings and community settings that it's hard to have a good conversation. So bring people to an environment that's not busy and where you can have more meaningful conversations. Speak clearly and share one message at a time. It's very important to give time to people as you're communicating. People living with dementia may need a bit more time to process information and come up with a response. So take the time when you're having those conversations. Show and speak. Sometimes, if your words don't make sense, sometimes just directing them to the person. So, if you're asking somebody to have a seat, maybe directing them and showing them where a chair is to really hone in on your message and make that instruction or that communication very solid and understandable. Use close ended questions. Sometimes asking too many questions or an open ended question may be difficult to process. So giving choices in your questioning can help somebody get to an answer that will be helpful for you. Very important is to respond to feelings, not stories. And often this becomes a problem because we're trying to find the truth in everything that's coming out and that's being said to us. If a person is showing behaviors that is aggressive or uh, is upset, maybe addressing those feelings and recognizing that the person is having a moment and really acknowledging the feelings that are coming out, not what you're hearing necessarily as the words. Sometimes you'll try to communicate and it won't be successful. People living with dementia tell us that sometimes they have good days and not so good days. So on days that are not very good, sometimes the brain is not working as efficiently and effectively. So simple communication may also be challenging. If you're having trouble having a conversation, it's not working out, maybe it's time to either try a different way or try it another time. Really understanding what the needs of the person that you're communicating with are, and then offering the support that is most person centered in the moment. I know this was a short time and I rushed through a few different concepts, but you're welcome to call us at any time on our dementia helpline. This information is here and I'll put in the chat as well. And we'd love to hear from you if you have further questions and if we can take this conversation forward. But for now, I'm going to stop sharing my screen and I'm going to hand it over to Dr. Chaudhry.
Okay, thank you, Sana. And thank you so much to United Way and Laura for organizing this event and inviting us to be part of this presentation. I am going to, let me see if I'm sharing my screen. Maybe not. Give me one second. Actually, that's not what I wanted to share. I think I'm sharing the wrong thing. Pardon me. That's the what I wanted to share. I was sharing our project website, which I'll share the link with you, but that's my presentation. So it's wonderful to be here and great to see so many organizations here from different parts of the province, because what I'm going to talk about relates not only to Metro Vancouver, but also in different ways, small towns, rural communities, and that's something we're also very interested in as part of this project. So it fits in quite nicely with what Sana was presenting about the dementia-friendly communities. And we are in this project called DemSCAPE, we're looking at the physical environment of the community. Okay, so our project is titled, as you see, DemSCAPE, or BuildSCAPE for people with dementia, but it's also an acronym. It stands for Dementia Inclusive Streets, Community Access, Participation, and Engagement. I just realized that I have a short video. I need to share the sound. So let me just go back for 1 sec and then do it the proper way. Oh, I think it's okay. All right, good. Okay, let's move forward. So quick acknowledgement to the funding agencies. The major funding was provided by Public Health Agency of Canada, Alzheimer Society of Canada, and Alzheimer Society of BC. Our municipal partners are City of Burnaby, Richmond, and actually we have worked with City of Vernon. So this is our team. Notable that there are 3 institutions connected to this. Simon Fraser University, which is the lead organization for this project, and then University of British Columbia and University of Northern British Columbia. So I'm going to talk fairly quickly because I have quite a bit to cover. So hopefully everybody can understand what I'm saying, although I'm going to speak fast. So I'm going to cover this very quickly about the DemSCAPE project, some background, objectives, some findings very quickly, but I do want to focus on the knowledge mobilization tools that we have developed and briefly comment on our current project, which is based on the knowledge mobilization tools that we have developed. So quick context of this project, DemSCAPE project, is that first of all, acknowledging the reality that most people living with dementia live in the community, that yes, the chances go up of them needing more care and relocation to a care home. But by and large, most people are living in the community. So neighborhood-based services, amenities, and the built environment are critically important for supporting people living with dementia to be active, engaged in the community. So within the context of physical environment, one of the important things that are that we need to acknowledge is spatial navigation. Spatial navigation is basically moving from one place to another. From I go out from my home, how I get to my workplace, how I get to the grocery store, and things like that. So that is a complex cognitive function which includes many things, including spatial orientation, mental rotation, etc. And without getting into the details of this is essential for independence, safety, quality of life for all of us. We are doing this every day, and we take this for granted for the most part. So, but spatial abilities, planning, and memory-related difficulties exacerbate when people have mild cognitive impairments or have been diagnosed with dementia. So we know that anecdotally, and there's some also evidence about how people have anxiety or feelings of loss and anxiousness and frustration. Am I getting on the right bus, or is this my right stop? Have I reached my destination? Once I'm coming back home, how do I know I'm on the right path? Sometimes feeling lost can be quite challenging and difficult. And then over time, people may become dependent on their care partners, spouses who need to go out with them. So there's a shrinking world effect for the physical and social activity for people with dementia over time. So within that context of the physical, the neighborhood context, we want to acknowledge the neighborhood-built environment design and planning, when done properly, can support independent mobility, have access to services and social networks, and of course, general social participation. And one of the things that is important to mention, that the one key issue of what we're talking about is about supporting people living with dementia to be active, engaged in the community. But at the same time, there is a growing evidence that by doing this, by staying active in the community, staying engaged in the community, staying independent in the community, also contributes to prevention of progression of dementia. So there's a preventive side as well of what we're talking about here. So when we get to the actual nuts and bolts and the important aspects, these are the 6 design principles or planning principles that people have talked about, scholars have talked about, that are important when we talk about dementia-friendly, dementia-inclusive communities. These are familiarity, comfortable, accessible, distinct, legible, safe, and they overlap quite strongly with age-friendly communities. However, some elements, some principles, such as familiarity, such as distinctiveness, legibility, these are more important when we talk about people living with dementia and supporting them appropriately. This is a conceptual model that we use in our study, which is showing, as you can see, three bubbles, and each is relevant to a different set of physical planning variable or concepts. So the top one is about walkability and land use strategy. So what that means is, for example, small blocks. How we design our streets can affect how easy or difficult it is to get from A to B. Okay, hierarchy of streets. And then underneath, in the very bottom, is urban design and comfort, for comfort and safety. So this could include accessible public toilets, very important element that we have seen over and over people mentioning, enclosed bus shelter, and so on. In the middle is wayfinding, clear signage, and not only clear signage, but appropriate signage. When somebody has dementia, they may be able to not read the street name. So maybe there's an icon, there's a symbol that needs to come on. Distinctive features at junctions, so landmarks, things like that. So all of these broad categories, walkability, wayfinding, and urban design, are important when we talk about dementia-friendly physical environment. So these are project objectives. So very quickly, the first one is to identify, where do people go on a regular basis, right? And how things may have changed over time since their diagnosis. So that's something we looked at in the study. We really looked at, this was an important part, the second one, to identify the environmental features that people connect with and that affect their outdoor engagement and social participation. And in our study, we used very community-based innovative research methods, where we engaged with people living with dementia and care partners in a very in-depth way to understand their issues as they're out and about in the community. And finally, our DemSCAPE project has a very strong knowledge mobilization component, where we develop some resources that I will touch on. So we engaged with 32 people living with dementia, mild to moderate dementia, and the care partners in some cases. In Metro Vancouver, we had 26 participants. 11 of them are individuals who participate directly on their own. And then 15 of them have the care partners also participating in our study. And we included Prince George in the study because Prince George, as you all of you know, I'm sure, is in an urban form, is different landscape than Metro Vancouver, more small city, small town, some rural areas as well. The urban form is less walkable. Of course, the climate is different as well. So we have collected data from Prince George as well, and currently we're analyzing the data. So we had pretty extensive engagement with each participant in our project, where we had 4 sessions. And very quickly to mention what these sessions are. The first session is when we sat down with them and did a structured questionnaire. And the questionnaire is called Act Out, or Activity Outside the Home, where we asked them, where do they go regularly, how things have changed over time, and prospectively how things may change. Are there certain destinations they might not go or might not feel comfortable going in the future as the progression in dementia happens over time? In the second session, we asked open-ended questions. So these are semi-structured interviews about their walking patterns. So where do they walk? And how do they get there, and so on. And we also conducted route planning. Route planning was specific to session 3, which is our walk along interview. So we identified a route they regularly go, by that at least once every 2 weeks. It could be a library, it could be a workplace, it could be a senior center, it could be a community center, it could be a grocery, whatever that might be within their neighborhood that they walk. And that's what we did in our session 3. We walked with them. So it's called walk along interview. And then we video recorded, and also the walk along, the walking experience. And we had conversation as we were talking. And then the final session, it was a sit down session. We showed some clips from the video that was collected during the walk along, and provided a context for them to reflect on the walk along interview and provide additional information. So this is a photo from during a walk along interview. This is a person living with dementia who's walking with us, and then one of our team members. There are 2 team members who are walking behind. So when we are doing these walk alongs, we had 3 team members going, and then the one person is really interacting with the participant, but the others are doing other things, taking notes, taking photos, but also taking video. So we had this GoPro camera on one of our team members who was video recording. We also invited the participant, the person living with dementia, to put on the camera if they were comfortable, and many of them actually did put on the camera. So it gave us a very unique perspective, experiencing, understanding the walking path through their vantage point. So currently we are in the process of analyzing the data. So lots of data are being analyzed. We the thematic analysis, we're doing video analysis, we're doing quantitative analysis. We're also doing GIS analysis. So I want to rush through, briefly touch on a few findings before I get to the knowledge mobilization resources. So people talked about obstacles quite a bit, that many things that we not always realize they can be important obstacles for people. People talked about the sandwich boards and the disruptive for participant using assisted device. Somebody commented about visual barriers when you put in these, not just physical barriers, but visual barriers of not seeing what's coming, right? Overgrown bushes can be problematic for people to get near to the curbside, which is not comfortable for some people. Some of the participants talked about the importance of places to stop and rest. In this case, the participant is saying he stops there, I stop over here at this driveway or whatever you call it, and nobody comes out. They don't yell at me for stopping. So people want to stop occasionally and just reorient themselves, and not just physically tired, more so about cognitive reorientation. So availability of benches and with armrests to rest and with the view of interest was critical to some participants. So this has implication for physical planning, how we design cities. Are we creating stopping areas and with benches and so on? Pedestrian visibility as crosswalk at roundabouts. There are several roundabouts in the city of Vancouver. And some people commented, some of the participants commented about that then the pedestrians are not visible for the drivers in the roundabouts. So turning cars don't quite always pay attention in these situations where there is no stop sign. Pedestrian signalless crossing, interesting point. One person said the audio cue that we are typically used to in many municipalities in this province, she commented the beep, beep, beep. Sometimes even now I wonder what is beeping, which one is beeping. So beeping, we take that for granted that, yeah, this is helpful, but not always. For somebody with dementia, the beep, beeping sound may not be associated that I need to cross. So we need to think broadly and creatively and thinking about what might be more effective audio cue for somebody living with dementia. Familiarity with an understanding of neighborhood environment. This was an important part. Taking familiar routes, not just taking any route, but planning before they are getting out of the home or which route they are going to take to get to the destination. And then identifying streets. So somebody commented about being confused about street and avenue. Okay. And also people commented about when we have street numbers versus names, and numbers are less preferred than street names, in addition to the street and avenue confusion. Orientation and wayfinding can be supported by a number of things, not only good sight lines, what you can see, but also following transit routes to know that there's a bus stop and that the bus stop could be my landmark. So landmarks don't need to be something large. They can be very small but important for a person who can take advantage of landmark for the cognitive understanding. This person talked about the artwork over there as different. The different is good. I look for it, and then it helps her to understand where she's at. So let me just change gears and talk about the three knowledge mobilization resources that we have developed in our DemSCAPE project. And these are ways to understand what is important and how can we raise awareness of this issue about the neighborhood built environment and really engage meaningfully with different stakeholders. And stakeholders can be municipal planners, municipal partners, community-based organizations, decision makers, and so on. So we have three resources. One is the Dementia Inclusive Planning and Design Guidelines, which is specifically for municipal planners and other decision makers. Environmental Audit Tool, this is a community advocacy tool where community advocacy organizations or people living with dementia can take the tool and as they work with us, we can work in the team to look at the neighborhood environment across a street section, like a street blocks or intersections, and do an audit. So it's an easy to use audit tool. This is not a research tool, this is an advocacy tool to be used by organizations and people living with dementia. And then finally, we have an education and advocacy video to increase community and public awareness of the understanding, and this was based on 3 study participants. So the Dementia Inclusive Planning and Design Guidelines, it's actually online on our DemSCAPE project site. In this, the key audiences, as I mentioned, was municipalities, but also developers who are building buildings. And buildings have an important role to create dementia-friendly communities as well, beyond the urban scape, the streetscape, community organizations, and of course, people with lived experience. So the guideline come as 6 principles that guide the actual content of the guideline. And it's organized by 3 realms. I'll talk about the 3 realms in a minute. And across these 3 realms or 3 scales of the environment, there are 20 strategies of what can be done. And within the strategies, we have 70 actions, very specific things that developers, that municipal partners can consider as they are making interventions or they're building new communities. So these are images from the dementia guideline that I mentioned, which you can access and download from our website. The first realm is the neighborhood scale. Neighborhood scale means broadly how we are doing the block level decisions. So these are decisions that physical planners make for cities. Okay, so for example, land use, very important. Land use really makes, it really creates an important influence on how we design our communities and cities. Is it single use, only residential, only commercial, or is it mixed use? Okay, so that really has an important impact of how we're able to access amenities and support mobility. Street grids, how are street grids laid out? That's also part of neighborhood scale decision. So again, under the second realm is the street scale, which is the segment level. Street segment or block, two different terms can be used to describe the street scale: pedestrian paths, sidewalks, pedestrian crossings, and so on and so forth, transit stops. And then we finally have the detailed design scale, which would include seating, public washrooms, signage, ground treatment, and so on. So each of these realms are dealt with quite extensively in our guidelines. So as you can see in this realm too, we talk about the importance of the broader context of the neighborhood context, and this scale has 5 different strategies, and each of these strategies has several action items. So in the interest of time, we're not going to go into the actions, but I'm going to give an overview of the guidelines that I'm talking about. And the second realm is, actually this is detailed design. Sorry, this was the second realm, the street scale. Again, okay, neighborhood scale had 4 strategies. And then street scale has 5 strategies, and then in the detailed design scale we have 10 strategies, as you can see that. And as I mentioned, each of these strategies are explained further in various actions. So we are working with municipalities for the implementation in really identifying some higher priority design strategies and actions. And I'll talk about that a bit more in the next part when I talk about the ongoing project. So let me just talk a little bit about the environmental tool. This is the second resource that we have developed. So this is easy to use, as I mentioned before, and user-led. User-led meaning this can be used by a person with lived experience of dementia and their care partners and community stakeholder. And the objective of this tool is to document the barriers and facilitators in the neighborhood environment that promote or restrict mobility. So this is a way to empower participants to voice and advocate for their needs. So it's one thing to talk about, yeah, we have these issues, our physical environment in our community is not that dementia friendly. It's another thing when you're using a tool to systematically collect data and then take the data to the council and say, okay, here are some specific areas that need some intervention, right? So that's basically the idea. The structure of the SWAN tool, which is our dementia audit tool, has 5 items, 5 domains, not 5 items, but 5 domains: functionality, safety, appearance, maintenance, land use, supportive features, social aspects. So the way it's done is basically we would go to, we would take a person with lived experience or their care partners, and then walk from one end of a street block from here to here, and then cross the street, the segment on the other side, come back and walk around. As we're doing this walk on that segment, we're collecting data. We're looking at the sidewalk, we're looking at benches, we're looking at crosswalk design, and all of these elements are captured as part of this audit, which takes about 20 minutes for each block. And we have done that in a few municipalities in BC. So finally, the knowledge mobilization tool, number 3, is education advocacy video. This is to educate, raise awareness on the role of the environment, the built environment, as an essential component of dementia-friendly community initiatives, and then really challenge the stereotype that what does it mean to be a person living with dementia? The point being, a person living with dementia can still stay engaged and active in the community if the physical and social environments are supportive. So the 3 study participants that were part of this video are these 3 individuals. And I'm going to just share, this is a 2-minute video. We can quickly look at it. This is a teaser video. Our full video is 8 minutes. And this is a teaser just to give you a preview.
Awesome. So we will walk, both of us first, and then both of them will follow. Right on.
Because of my disease, I'm not able to drive. I like to get out in the fresh air. I think that that's important for my health and well-being, getting the blood pumping to my brain.
I get lost 2 times already. So I'm worried I get worse, later. So
At this corner here, where do you go or how do you get back to your place from here?
Straight along here.
So you walk along the grass here.
Oh yeah. No matter where you go in North America, it is geared to driving. It is not geared to walking. The only thing I can really say about this whole scenario, it might not help me, it might not help her, but hopefully it will help somebody else.
I encourage you to go to our website to see the full version of this video, which is 8-minute video. Yeah, special thanks to the people who participated and also our technical support. So in our current project, which is an extension of the DemSCAPE project, it's a knowledge mobilization project. We are engaging with a few municipalities in BC. We are working with City of Burnaby and City of Richmond, and we have conducted world cafes where we streamed the video. We had focused discussion about how the video can be used for raising awareness, understanding. We have conducted focus groups with the municipal partners. This is a municipality focus group project, and where the idea was to share how they can use the dementia inclusive planning and design guidelines in their standards, in their decision making. And in the fall, we're going to conduct some audits in what we're calling some neighborhood hotspots and identify what can be done, the intervention that the cities might be able to do that. As I mentioned, we also worked with City of Vernon in co-developing an evaluation of a stigma reduction training, and also working with the municipal planners there for use of our guidelines. So the final comments from the DemSCAPE project is that our project generated evidence-based. We don't have a lot of evidence. We have anecdotal understanding stories, but our project is really creating a strong evidence base about what are the features in the neighborhood environment that really affect, influence people's mobility and community engagement. We used a very innovative mixed methods, including first-hand experience, as I mentioned, and our project generated 3 KM tools that are engaging various stakeholders. And also we are planning to work with the National Knowledge Mobilization Hub that is forthcoming. And then we are also doing similar projects in a few countries, including Switzerland, Germany, and Singapore. So, but we are really looking at other municipalities in BC, both in Metro Vancouver as well as in the interior and the north, to look at the diversity of urban settings and suburban settings, and make some interventions. So that's our website and our email address. So feel free to get in touch with us. Okay, I'll stop there. Thank you so much.
All right, thank you so much, Sana and Habib, for those wonderful presentations and also all the useful tools that you've shared. I know I myself have used one of those environmental audit tools before, and it's a really interesting and fun experience. So I'd encourage people who are interested to go online and look up those tools, as they're great items that actually can be used by people in the community quite easily to see how dementia friendly your environment is or is not. So we have a few minutes left, so I'd love to open up the chat or to questions if people want to put questions in. And we did have one question already come in, so I'll ask that question while people are putting in other questions they might have. So this question I think probably would be for you, Sana. And a person was wondering whether there's any monthly meetings or forums where organizations that are working with people living with dementia also meet with people who are working in the areas of harm reduction or substance use. So do you have any comments on any connections or meetings that might be occurring in those areas?
I'm just reading the question as well. So is the question if people living with dementia? So I believe the question is if there are any monthly meetings amongst organizations working on dementia. Um, I'm not particularly aware of anything that is provincial, um, where people are coming together to talk about harm reduction and substance use. But I am going to do some research and perhaps try to see if there are any, but not to my knowledge. But Laura, I'm actually going to pose that question to you, given your work with United Way and healthy aging. Have you come across any organizations or groups like that?
Yeah, no, I haven't come across anybody who's working that specific intersection of dementia, substance use, and then harm reduction. So that's a really interesting question that's been posed. And I know the person had put their contact information. So I think we can all see if we can find anything to answer that question. But for now, we don't have, unfortunately, any knowledge of that type of group. All right. Do we have any other questions that people would like to ask, either Sana or Habib? All right. Well, I do have one question that I would be interested in asking. So, as you probably know, a lot of the audience, I think, are community-based senior services. So they might be working in nonprofits, community centers, senior centers, etc. So, in that case, from the perspective of a community organization, I'm wondering if both of you could talk a little bit more about how they could use your resources or some of the information that has been presented in order to support people living with dementia in their communities. So what could their role potentially be in making the community more dementia friendly?
I can go first. Yeah, I mean, among the three tools that I talked about, two are targeted to community organizations. The video, which is not the 2-minute, but the 8-minute, the full version video. And we have, if you get in touch with us, we're happy to share more information. We have developed a discussion guide based on the video, so which can be used to raise awareness with community organizations and municipalities about the importance of the challenges people face when they're out and about, and then how they have to consider many things that we don't always think about, and about the physical environment and so on. So that's a raising awareness video and engagement. And the second thing is the environmental audit tool. Again, the audit tool is easy to use, it's downloadable, and we are happy to partner with municipalities or organizations. So organizations, so second one, that one, the audit tool is really for community partners, community organizations who can actually work with or invite people with lived experience to take part and identify, do an audit in certain hotspots, certain intersections, and they can also invite the municipal partners to be part of that team, either directly, or they can take the data, take the findings, and take it to the city and say, these are the issues that we want to talk about, bring forward in council meetings. So I think those two tools are directly addressed or designed for community-based organizations, advocates. The planning and design guide is more about municipal planning in a physical planning in a more concrete way. So they complement each other. Yeah.
I can add on to Habib's points. At the Society, we do offer a few ways to engage with community organizations and service providers. So we offer dementia-friendly training. It's in various parts. So we have an intro to dementia, as well as how to make your organizations more dementia-friendly. So we talk about the kind of what we talked about very briefly today, but we go into more detail about what dementia is and what are the changes that come with that, how you can make your programming more dementia friendly, how you can understand behaviors and support your communication more effectively. We also work with organizations to create more policies and work around how to make their workplaces more dementia friendly. We have a few workplace guides on our website as well that are available to anyone interested. We also have a few checklists, dementia friendly checklists around the environment, written communication, and behaviors that is available to workplace organizations working towards becoming dementia friendly. So if you're interested in any of that information or just want to have a chat and learn more, please feel free to connect with myself, and I'll put my email address on the chat.
Yeah, thank you, Sana. As a follow-up question, somebody's put in the chat, is there a dementia helpline number to help caregivers with directions to resources?
Absolutely. Yes, I did post that First Link Dementia helpline number at the top, but I'll repost it here. So this would be the best place to, this phone number is best for care partners, for everybody interested to learn more, and especially for care partners. Also to know that it is confidential and it is available in various languages. So definitely invite you to take a look. I am having trouble reposting, so I'm going to share it again.
All right, wonderful. Thank you very much. And in that case, we're at the end of our time, but if there was just one last question in the chat, so I'll just read it out in case there's anything you want to comment on it. So the person was saying, I wonder if there's a specific kind of dementia that's related to the root finding issue being front and center. So I think the person's wondering if there's certain types of dementia that are more associated with the wayfinding or root finding issues.
Yeah, well, I can address that issue. I mean, all dementias at some point or other, or most dementias, have some point of other would affect orientation and wayfinding challenges. The question is, when does that happen? So in some cases, in Alzheimer's, it happens the mid stages. In frontotemporal dementia, it happens a bit later. So it does happen, but at different stages of the dementia. So the issue of route planning is relevant for all dementias, or most dementias at least. But when would that happen? That would vary. But as we know, most people, as Sana mentioned in her presentation, if we talk about the dementia universe, dementia people affected by certain disease that is causing the condition of dementia, most of them, a majority of them are having Alzheimer's disease, where spatial orientation does get affected in the more the moderate stages. So this is something that is an important aspect for anybody living with some disease that is causing dementia or dementia symptoms. So it's across the board. It's a question of what time does it happen more or become more acute.
Thank you very much for that answer. I'm still learning stuff. Habib was my professor when I was a student, and I'm still learning from him. So thank you. In that case, I think we're at the end of our time. I do see there's a question asking about your contact information, Habib. So if you maybe want to put that in the chat as well.
Sure.
And I know there's been a lot of resources that have been shared today. So in the follow-up to this webinar, we're going to be able to share the recording with everyone. And then also, if you're okay, Sana and Habib will share your contact information and the various links and information that you've shared so people can follow up with you if they're interested.
So I have shared my email address as well as our DemSCAPE project website URL. So I would invite anybody interested to more about the project, please visit the project website, check out our different tabs, especially the knowledge mobilization tab, which has the 3 resources, and feel free to get in touch with me if you have any question.
All right, wonderful. Well, thank you both so much for this very informative presentation. I think a lot of people are looking forward to looking more at the tools that you've shared and the resources and learning more about the topic of dementia-friendly communities. So thank you very much for joining us today. And I hope everyone in the audience had a very good time taking in this information. There's definitely lots of stuff to soak in. So I hope you found this very informative, and thank you for attending to our audience members. And thank you, Habib and Sana, for the wonderful presentation. All right.
Thank you. Thanks for
Thank you,
having us.
everyone. Thanks, Laura. Thanks,
All right.
Sana.
Take care, everyone. Have a good
Bye.
afternoon.